everybody, and welcome back. Thanks for joining. Today, we're going to do a topic. It's called metabolic syndrome. If you're not familiar with it, we're going to go over it. It's not exactly heart related per se or heart failure related, but it is something that can cause you to get heart failure or something that can make it a little bit more difficult to live with. One thing I do want to ask before I start this video, just for those of you that regularly watch, if you notice anything weird, since I've got a kind of a new setup now, if the volume's weird, if something sounds weird, if it's not good, just let me know in the comments so I can work on fixing it for next week's episode. I would definitely appreciate that, and I'm sure everybody else would appreciate in future episodes. But we'll go ahead and get started on this topic. And to begin, of course, with anything medical on the internet, you want to have a disclaimer just to make sure I protect myself and so that you guys don't take my information in a direction that it's not intended to. First, I'll say, hopefully this isn't happening, but if you're having a medical emergency, please stop watching the video and call 911 or whatever country your emergency code is. And if you don't want to do that, at least have somebody drive you to the nearest emergency room to get evaluated. Definitely don't want anything bad to happen to you, and don't watch any videos to try to diagnose. It's not going to help. You need more than just a YouTube video to diagnose yourself. And as always, these videos are for educational purposes only. They're not intended to diagnose, treat, or cure you. We do like you to use these videos, though, to formulate questions. You can use those to ask with your doctor, your care team, to kind of help you better manage your condition. Definitely do not use this information in this video without consent from your doctor or care team. If you do, that responsibility is going to fall on you, and definitely not myself, as it's not intended to treat or cure you or anything like that. So just, like I said, use this for questions. And the information that I do get, when I get it, I consider it from a reliable source and known to be accurate at the time of recording, but this can change in the future. There may be times where I do update videos or revisit a topic if something drastically changes, but again, that would be on you, and that's why we want you to use it to ask your doctors questions. That way, if things do change, they'll be able to guide you in the right direction for your care. So getting started, what is metabolic syndrome? It's actually 5 different symptoms of metabolic disorder. The first one, and obviously these are not in any particular order, is a large waistline, high blood pressure, high blood sugar, high blood triglycerides, and a low HDL cholesterol. So in order to have metabolic syndrome, you have to have 3 or more of these. And it's not always an official diagnosis from your doctors. If you look on your chart, you probably won't see metabolic syndrome, but you'll see these. Other ones, probably not the large waistline. They might put it down that you're obese, but other than that, you just kind of have to know, and you can ask them about it, but just knowing that 3 or more of these symptoms is considered metabolic syndrome. This does increase your risk of coronary artery disease, type 2 diabetes, stroke, and other serious health problems. And in the US, about 1 in 3 people do have this. So like I said, just talk to your doctor about it, and we'll go over all this stuff and hopefully get you some good questions here, or some stuff you can get some good questions to ask them. This is a preventable syndrome. However, once you develop some of these health problems, they're not reversible. We'll go ahead and say something like, high blood sugar. Generally, once you have diabetes, it can be managed with diet, exercise, and medication. Even if you're not on medications, you're still probably going to be diabetic. Most people, I'm sure there's some that can truly reverse it, and that I haven't looked into, but for the most part, especially with that one, once you get it, you're kind of stuck with it for life. The first one we'll go over is large waistline. It's fairly self-explanatory, and it's the only symptom that you'll have that is pretty much blatantly obvious to you. There's kind of two different body types for people that put on some extra weight, not, those people fortunate enough to be slim their entire lives. But there's the apple body shape, which is where you have the large waistline. And then there's the pear body, where you carry more of your extra weight in your hips and your thighs. So this would be considered the apple body shape, where you're just round in the abdomen. So a large waistline, that generally means the circumference around your belly button. So if you measured around your entire waist at your belly button, that would be your waistline. It's not, like where some people have their pants underneath their stomach. So they might wear a pant that's like a 32, but their waist could be like a 42. So we're talking about the waist over the belly button would be the actual measurement you're looking for. And the ones around your hip, that's your pear body shape. So that's not the one we're talking about. It's strictly just around your belly button. So the high blood pressure, that's the next one. Also can be called hypertension, especially if you're looking at your charts. That's probably how you're going to read it. There's two parts to blood pressure. There's the top number, bottom number, which is systolic and diastolic. So normal blood pressure is considered a top number less than 120 and a bottom number that's less than 80. So if you have both of those, that's considered normal. An elevated blood pressure would be the top number of 120 to 129, and the bottom number is still less than 80. So high blood pressure essentially begins when you get to 130 or more in your top number of the systolic, and or 80 plus in the diastolic. So you could still have, like a 118 for the top, but if you start getting into the 80s for the bottom number, you're considered to have high blood pressure. And one thing that you do want to watch out for, especially if you have a heart condition, is, or even if you don't, for anybody, but especially a heart condition, probably have a better chance of having what's called a hypertensive crisis, which is where you get 180 or greater in the top number and or 120 and greater in the bottom number. With that, you definitely want to consult your doctor immediately. If you can get them on the phone, if you can call the office while they're open. If not, you're going to want to go somewhere, probably the emergency room, to get evaluated. You could go to an urgent care, but most urgent cares, if you have that high of a blood pressure, they're just going to send you to the emergency room anyway. I know that's not very fun, and especially if you're in the US, it's pretty expensive. But in my opinion, if it is that high, it's definitely better than what could happen if you don't get any doctor's care for it. So the next, we have symptoms of high blood pressure. High blood pressure generally doesn't have any physical symptoms. It's often referred to as a silent killer. Not because it kills you right away like a heart attack or a stroke may, but over time it just wears your body down. You don't know what's happening. Like, I know a lot of people will know if you get super high blood pressure out of nowhere, you're going to have the headache. You could have the nosebleed, shortness of breath, blurred vision, chest pains, possible other symptoms. That's not necessarily the silent killer that it's talking about. This is where it's gradually gets higher and higher over time. Your body adapts to it, so you won't necessarily get any symptoms to it because your body is adapting. So like it says here, a lot of times these symptoms do occur only when blood pressure reaches dangerous levels. And the dangerous levels, they don't happen over time. That's something that more than likely is going to happen very quickly. So that's why you're going to get the symptoms to it. The next one on the list was the high blood sugar or diabetes. There's two types of blood sugar tests that are commonly used. You have your blood sugar test, which is your finger stick, which is probably what it should say, but it doesn't. So sorry about that. But that's just your common where you see people prick their finger, test the drop of blood. And then you have the A1C test, which is definitely more accurate for determining if you have diabetes, since this is something that takes an average blood sugar from your red blood cells, like it says down here at the bottom, over the past 2 to 3 months. So that's more accurate for diabetes. Like it says here, the blood sugar test, which is where you do the finger stick, that's just like a photograph of your blood sugar at that time. So that's not going to be something that's going to be diagnostic um, as far as for diabetes for the most part. Sometimes you can use that but your doctor's probably going to do the A1C test, just because that's going to be the most effective way to say, yes, over time, your average blood sugar has been high enough to be diagnosed with diabetes. And like it says here, the A1C test, it measures the percentage of red blood cells that have a sugar-coated hemoglobin. So the hemoglobin, that's the oxygen carrying aspect of your blood cells. And somebody smarter than me that figured out that it does get covered in sugar or glucose and it can be measured. As far as that's the most I know about that kind of stuff without getting into too much science stuff. So as far as for testing for diabetes, like I said, the finger sticks, they can be used to suggest it. So if you have 2 random blood sugars over 200 at any time, will suggest diabetes. You can do fasting blood sugars if you want to test as well instead of just randoms. So that would essentially be not eating overnight, or probably about 8 hours be a safe bet, and only drinking water. Your blood sugar, if it's less than 100, that's considered normal. Anything from 100 to 125 on 2 separate occasions is considered pre-diabetic, and that would be fasting. If you eat, then it's going to go potentially up into those levels, so that doesn't count. It has to be fasting. And a blood sugar over 126 or higher on 2 separate occasions would be considered diabetes. But like I said, you're not going to be able to diagnose that yourself. That's something your doctor, you'd have to talk to him about. A1C testing, if you do get that, below 5.7% is considered normal. 5.7 to 6.4 is considered pre-diabetic, and 6.5 or higher on 2 separate occasions, they will diagnose you with diabetes. And that's something, I think there are home A1C tests, but don't go by those. Let your doctor do it. Let the labs that they send your blood work to, let them do it. And then, on top of it being probably more accurate, your doctor's involved so that they can, know for a fact that you do have it and help you get treatment for it. And like it says here, remember, only a doctor can officially diagnose you with diabetes. So if you suspect you have it, talk to your doctor. And I think the best thing to do is, even if you're not diabetic, talk to him about getting testing for it, maybe, every 6 months or every year. Especially some of these medications that they prescribe. I haven't looked into it personally, but I have heard that they can sometimes cause diabetes as like a side effect to some of these medications. So it doesn't hurt to get tested, and more than likely you're going to get your blood tested for other stuff anyway. So just ask them if they can throw that on top of it, and you can do that just to make sure that you're in the clear for that. So some symptoms of high blood sugar. Early symptoms, frequent urination. You're definitely going to notice yourself waking up probably at night more than you used to, and even during the day as well. But most people pay attention. If, hey, for some reason I'm waking up 3 times every night to go to the bathroom, you're going to, that could be a sign, and you're going to want to, regardless, talk to your doctors about it. You can also get fatigue, increased thirst. The increased thirst will, from what I understand, you're going to have a higher blood sugar, which will essentially make your body feel like it's dehydrated, therefore you become more thirsty. And you can also get blurred vision. And when I've talked to my eye doctor before, they did say that when you have diabetes, that your vision can change a little bit based on your blood sugar level. So it can be different when your blood sugar is higher, if it's uncontrolled, which is why you kind of want to control diabetes as well. Besides the obvious, it does help, stabilize your vision. Some dangerous symptoms, which can also be called diabetic ketoacidosis. which that you don't want to confuse with, the diet trend of eating keto. This is totally different. The biggest one is the fruity smelling breath, and that's kind of the first symptom a lot of people notice. After that, you started getting into pretty dangerous symptoms, and this is a dangerous condition to have, and you will end up in the hospital if you get it. You can also get shortness of breath, confusion, loss of consciousness. So if you get any of these symptoms, I mean, regardless if you have high blood sugar or not, definitely go ahead and seek immediate medical attention. And the best thing you can do, like I said, regular blood work does help catch you in prediabetes or in diabetes early, which is a good thing. If you're pre-diabetic, you can definitely work on not developing diabetes. And if you have diabetes, it's better to find out early because there are some pretty severe complications that come with it if it's uncontrolled for a long enough period of time, which, it can be the vision, definitely vision problems. It can mess with your eyes. You can get the neuropathy where you have kind of the burning and then eventually numbness in your, especially hands and feet. And severely, that goes long enough, it can definitely cause people to get to a point where they may have to get something amputated. So while it's no fun to find out you have something that's not good, like diabetes, it's like, really like anything else, it's best to find out early so you can at least try to manage it. The next one, high triglycerides. Triglycerides are a type of fat that's found in your blood and can be measured with a blood test. This can raise LDL cholesterol levels, which is the bad cholesterol, and in turn can raise your risk of heart disease. And if you have trouble remembering LDL from HDL, one way you can remember good and bad's for most people is always going to be higher when they get the cholesterol checked. Another way is LDL is bad, HDL is good. So if you think L for lethal, LDL, bad cholesterol. And like some of these other things, this is a condition where you're going to have no symptoms. But, like I said, with blood tests, you can find out when you're getting into the danger zone. The 4 levels you do have for fasting, for a healthy adult, you want it to be below 150. For a child or a teen between the ages of 10 and 19, they want to be below 90. Borderline high, 150 to 199. High would be 200 to 499. And very high would be 500 or higher. And this one, it can be partly genetic, but this one here is very, very much based on your diet and activity level. If you have a healthy diet and you're active, even if you're not active and you keep a healthy diet, this, for the most part, should probably not get into the very high level. There are always that exception where people do need medication just because it's a genetic thing. But this one can be pretty well controlled strictly from diet and exercise. And then the next one would be your low HDL, which is your good cholesterol. And the reason it's good is because it removes the LDL or bad cholesterol, especially if it starts building up in your arteries. So like it says here, the high levels of the LDL can build up the plaque on your arteries. The HDL helps remove it from your blood and sometimes can help reduce the buildup in your arteries. I'm not going to say 100% of the time, but it can help out if you can get that balance to where you have higher amounts of HDL. And again, this is an asymptomatic condition and generally diagnosed with blood tests. And the ranges for men, desirable, you want 60 or above. Me personally, I don't think I've ever seen 60. I don't even think I've ever been above 40. And for me, it's a genetic thing on top of probably diet and exercise. But, this is one of those that can run in your family, especially, if one of your parents has what they might say bad cholesterol, then, sometimes there's nothing you can do about it and you do need medication. And getting off topic again, but for women, desirable 60 or above, and you kind of get the short end of the stick because your low end is, or for low levels for you, is considered less than 50, which I do not know the science behind that or the reasoning. This is just what I found in all the sources I've looked at. So as far as for prevention and treatment of metabolic syndrome, definitely always want to follow your doctor's advice for prevention and treatment. They're going to know your health the best, and definitely give you the best direction towards how to do it, how to fix it, or prevent it, or maybe even, try to prevent or reverse one of the 5 things. Because even if you can do that with one, that's still going in the right direction. And this can possibly be prevented or possibly reversed with healthy diet and or exercise. Again, some of this stuff's come down to genetic. I know for me personally, blood pressure, cholesterol is always going to be genetic. So I need medication for this, and I probably always will no matter what I do, which that's okay. Like I said, it's best to know and be able to take that medication to help keep yourself as healthy as possible. You can also get medication for the diabetes, cholesterol, the waistline. You're going to kind of have to do that on your own. The cholesterol, will group that up with the triglycerides, but that one you're also going to want to just essentially have the best diet that you can. Try to eat healthy if you can, try to exercise. And for high blood pressure, that's also another one where you're going to want to do a healthy diet, exercise. For myself, it's always going to be medication because I was genetically blessed to have high blood pressure. And prevention and treatment does not eliminate developing health complications like heart disease. So just because you don't have metabolic syndrome, or if you can reverse some of this stuff, unfortunately, people still can develop health complications like heart disease. So even if you are healthy, think you're healthy, a lot of these things can creep up on you, never know it. So it's always best to make your regular checkups with your doctors, even if you are healthy. Like I said, nobody wants to hear that news that they do have something, but once you do, you can get on treating it, and that's really the best thing you can do for yourself. All right, so some questions, things to ask your doctor. The best thing to do if you haven't had your A1C checked in a while, find out what your A1C level is, your cholesterol levels, and see if your doctor considers them normal. Different places, generally everything's about the same, but just make sure that they would agree with what I said, if you're in the normal level or not, and how they want to go about that. And if you are, let's see, you wanted to ask, what medications am I taking to bring my A1C and cholesterol to a healthy level? So you want to ask that if you do have any of these conditions that would require those medications. That way you can research and kind of stay on top of it. And sometimes you got to keep your doctors in check. I've had to ask them to change medications, add medications, move them around different levels or different doses. So definitely know your medications, and don't be afraid to ask your doctors if there's something different you can do if you don't feel like they're working the way you want them to. And that kind of goes into your next question. You'd want to know what the indications are or the criteria you need to meet for increasing, changing, decreasing, or discontinuing medications. Which I know sometimes it seems like we're on medications, we're going to be on them for life, but some people do get to a point where they can discontinue their medications. And it may not be all of them. It may be, I had 2 blood pressure medications, now I only need 1, which that's a big deal. Not only are you getting healthier, you're also saving money not buying that medication. So don't be afraid to ask your doctor that. They should be able to let you know what you can test for at home. It gives you a goal to work for too. if you know what you need to do to decrease or get rid of medications. So that's a good thing to know. Another good thing would be the best diet for you, and ask them if you should talk with a dietitian, which I personally do meet with a dietitian about once a month online. It works out good for me. I'm telling you, that's one of the better things I do, because not only do they give you good advice and work with your medical conditions, they balance your diet out for you, and it kind of somebody to keep you accountable, because you don't want to go back to them when they've given you goals and then just tell them you haven't even tried for it. So it's definitely good to get somebody to help keep you on track, hold you accountable. Another one is the exercise for your best overall health. So that, as we know, if we have heart conditions, that's a big thing to know what exercises are safe for me to do and which ones will get me to, the best place I can be, the best version of myself, being healthy and being physically active. And the last thing, I don't remember if there's another slide on questions, but you want to know what a reasonable time frame is to see results for whatever condition you're asking about. You don't want to assume because you see some nut job online who said in 3 months they lost 300 pounds and they stopped all their medication, and you can too. No, you can't. I guarantee you can't, and I guarantee you I can't. So don't listen to those people. Talk to your doctor. They'll give you a reasonable time frame. And that's something you can get a time frame. And it's, let's say it's 6 months, set up an appointment for 6 months with them to see where you're at in relationship to the results that they assume that you can get to. And that way, in 6 months, if you're there, that's fantastic. You can readjust everything to keep yourself moving. Or if it didn't work, you can see, what do I need to do? Can I keep doing the same thing? Should I switch something up? So it's all about working with your doctor and your care team to basically continually, probably for the rest of your life, just making sure you're working towards goals and you're keeping yourself as healthy as possible. So again, I want to say thank you for anybody who made it to this point in the video. Very much appreciated you watching it. If you want to, go ahead and subscribe to the channel. To me, subscribers, I don't know, I don't really need the ego boost of people subscribing. I don't watch it and judge myself by it. So if you want to subscribe, that's fantastic. You can turn on notifications and you'll know when videos come out. If you don't want to subscribe, you just want to get the information and use it to better yourself, that's perfectly fine too, because I'm not here for subscribers. I'm here to make sure people get accurate information and are able to take care of themselves. And, if you do subscribe, that's fantastic. Very much appreciated. If you want to leave a like on the video, even more appreciated. That does help people find these videos by it showing up a little bit higher on when they search for something. It'll recommend it to them, is what I'm trying to get at. So that'll help them find accurate information and not some of these nut jobs that sell false hope. And again, on any video, please comment the topics that you want to see me cover in the future. I have one person that did ask. I'm going to go look into that in the next couple weeks and try to see if that's something I'm able to do, and find enough information to help them out, and then in turn help anybody else who watches the video. But just leave a comment, let me know what you want to see. I have no issues looking into it and trying to make a video for you. And as always, take care of yourselves, and we will see you in the next video.